5, a new report showing that Arkansas children in BIPOC communities rank low in overall well-being. That study found one of the biggest factors is low birth weight for Black babies. 5 News reporter Rachel Williams takes a deep dive into this report and shares what resources are available for those who might need them.
New data from the Annie E. Casey Foundation's 2024 Race Results Report shows a baby's weight at birth is strongly connected to how they'll survive their first year of life.
One of the most important factors in future, either their future success or difficulties, is low birth weight. And that is because low birth weight can be from a number of things, but it also tends to tends to be because they were born early. And that means they weren't fully developed at the time they were born.
Marcela Garcia with Arkansas Advocacy for Children and Families says a low birth weight can lead to developmental delays and affect the child through adulthood.
So there's diseases that are more prevalent in kids that are born with low birth weights. For example, as adults, they might be more prone to things like asthma, diabetes, heart disease. So when we look at really important factors, birth weight is one of them.
When it comes to low birth weight, many different factors can come into play. One of them is not having the proper nutrition while carrying a baby, especially for minority mothers.
Because of the way systems have been in our country, Black communities, especially Indigenous communities as well, and other communities of color have been systematically excluded from access to quality health care, right? But even when you have that access, we know that that is not a guarantee that as a Black woman that you'll be heard.
Garcia says implementing new policies would have a major impact on minority families.
WIC is such a hugely important program because, again, that early nutrition intervention when someone's pregnant has such dividends. It's also a program that we know is so successful because it's a health targeted program as opposed to just a food program. They provide nutritional education, they provide nurses.
So, how does Arkansas tackle this ongoing issue?
One of the policies I would say is making sure that infants are enrolled automatically in Medicaid if their mom had pregnancy Medicaid, because again, they're presumptively eligible, and making that eligibility for 1 year. Because again, that infant mortality rate is that first year of from birth all the way to 1.
Covering news where you live, Rachel Williams, 5 News.